You think you're ready to start that IV, right? But are you ready to be 100% accountable for the outcome? What if you miss? What if you fail? I'm going to break down what I think you should do and what you shouldn't do on this One for the Road. I don't mean to brag, but I do a pretty solid job of starting IVs. In fact, I'd be willing to say that if you and we went stick for stick, I would say there's a fair chance that I'm better at it than you are. I know, we're a competitive bunch in EMS, and I'm sure that there's a lot of EMTs and medics out there watching this, and they're thinking, oh, you want to bring that game to my house? Well, no, it's not like that. The reason I think I have an advantage isn't because of years of experience per se or some innate talent or something like that. The fact is, I've probably missed way more IVs than you have, and that's it. My advantage is that I have failed at it way more times than the average medic on the street. You cannot make an omelet without breaking some eggs, and failure is a part of any skill development. But we don't always properly prepare for failure. I've missed a lot of IVs. You're going to miss some too. But I'd like to give you a few pieces of advice that might make you better at dealing with that moment. It's an awkward moment. You just cause the patient pain and discomfort. You cause them a minor wound for absolutely no advantage. And now you likely have to convince them to let you do it again. So my advice is to not compound the awkwardness of the moment with denial, with excuses, or with awkward silence. When you miss an IV, first and foremost, just apologize. Just apologize. I don't know why we're so resistant to that, but it's okay to say sorry when we wanted something to happen and it didn't work out, right? Some of us have been taught that admitting fault might incur some sort of liability, and to avoid it, research actually says the opposite. A sincere apology may actually reduce that liability. It doesn't have to be a big deal or anything. My apologies, Miss Smith. I wasn't able to get that one to work. I know that was uncomfortable for you. If you'll allow me, I'd like to try one more time. The other thing I'd like you to think about is don't blame the patient. And we're horrible about this. We want to let ourselves off the hook, right? I don't know if you know Jocko Willink, but in his extreme ownership, he has that quote that says, to lead means to own everything in your world, right? And when we make the choice to start an IV, we need to own it. So no more brittle veins, no more rolly veins talk. Wow, you got really rolly veins there. Oh, that was such a brittle vein. All veins roll. They're round. They're suspended in tissue. They're going to roll. It's our job to get the IV done. So when we decide to stick, we own the outcome. And the last one, this is one more I want to throw in because I see it sometimes and I've done it plenty of times. Release the tourniquet, right? As soon as we know that we've blown that IV, just have that reflexive action of reaching up and popping that tourniquet off. The longer the tourniquet stays on, the bigger the bruise for the patient. And I don't know why sometimes we're reaching for things and trying to pull out and we don't think about popping off that tourniquet, but it's an easy thing to do. So apologize, don't blame anything on them, and pop off that tourniquet. Hey, I'm Steve Whitehead. I appreciate your time. Thank you for watching. That was One for the Road.